Subcommittee will come to order. Welcome to the Ways and Means Subcommittee on Health hearing on exploring the use of technology and innovation to create efficiencies, higher quality, and better access for beneficiaries in our healthcare system. What I hope we can talk about today is not about increasing or decreasing Medicare spending, but about using the existing dollars already in the program more efficiently, focusing on goals like giving patients more time with their physicians, clinicians, and more control over their health information. I've heard from providers back in Ohio about clinician shortages that are jeopardizing access for Medicare beneficiaries who need the care. That scenario is both unacceptable and untenable. There are better ways to deliver care if we can lift barriers and incentivize greater efficiency among all providers.
There are vital minutes, hours, and even days wasted in the system because we lack the necessary transparency and automation that is so prevalent in other service industries. Efficiency is more than digitizing medical records. While crucial to the information sharing, medical records are not built to facilitate the movement of patients through a system. We see a nation in which every health system is enabled by an operational command center, connecting care for doctors' offices to clinics, to hospitals, and beyond. One that places real-time data in the hands of clinicians and administrators. One that sees everything, beds, patients, staff, and equipment. One that serves as a care traffic control center. Through efficiencies and increased productivity, these care traffic control centers are self-funding. No additional taxation is needed. Through these type of efficiencies, we can serve millions of more patients by utilizing our underutilized assets, helping coordinate care so our doctors and nurses don't suffer from the wasted time. Less frustrated doctors and nurses are happier people.
And on a personal note, Mr. Chairman, I'd like to just briefly talk about a man named Victor Phillips. Mr. Phillips had open heart surgery. After they completed that, Mr. Phillips was on a gurney for almost 3 hours because they forgot where he was. He needs to go upstairs. He just had open heart surgery, and he's been disconnected from all his monitoring machines. They got Mr. Phillips up to his room, but by that time, he had slipped into a coma. He lived for about a week. Now, this is a guy who was a World War II veteran. He survived a battlefield, but he did not survive his time in the hospital. The way I met Mr. Phillips is he was the father of my wife. And I watched as he lay dying and thought, if somebody had known where he was, this never would have happened. TeleTracking is a type of company that says this isn't going to happen anymore. We're doing it more effectively, more efficiently. And I tell you what, there's not a day that goes by that I don't thank the private sector for coming in here and telling us how to solve problems.
Currently, the United States spends 17.5% of our gross domestic product on health care.
It's not about the money that we spend, it's about the money we spend that's used inefficiently and effectively. The United States of America ranks 44th out of 51. And we've really worked hard. We've been able to beat Bulgaria, who's number 45, and we're just about catching up with the Dominican Republic at 43. And it is hard for me to sit here and look at who we are and what we've been and how we've led the world and everything. Gosh, we can put a guy on the moon, but we can't get him through the emergency room. We can invent the internet, but we can't get people through the hospital system.
So if we can take labor and help them become more productive, we can help doctors become more productive and not doing things they don't want to do, we then get more patients through at the same price.